I'm Dr. Cheryl Olson. I'd like to welcome you to Surgical Associates of La Jolla here in La Jolla, California at the Zymed building on the Scripps La Jolla campus. I have a general surgery practice which has a special focus on breast cancer and minimally invasive surgeries. That actually ends up encompassing quite a few things. Today I wanted to talk a little bit about hernias. A lot of people have hernias or think they have a hernia, and one of the questions that comes up is, why do hernias happen? Where do they come from? And it turns out that our bodies are designed in such a way that there are certain points where blood vessels and other structures need to go through an opening in the strength layer. And from time to time, that opening gets dilated a little bit bigger. And then some peritoneum or intestine, or most commonly fat, gets through that little opening and causes a hernia as we know it. Hernias can occur in the diaphragm, where the esophagus comes through, but most commonly people get umbilical hernias, inguinal or groin hernias. And then the other more common place where the fascia or you get an opening is in an incision. An incision is not a natural opening. So these other openings that I mentioned earlier are natural openings where blood vessels are designed to go through. When you have an incision, what happens is a suture pulls through the tissue from force and pressure, and then you get the opening dilating over time, and then the bowel can get through there. So hernias don't go away on their own, and they need to be fixed. Does every hernia need to be fixed right away? No. Many hernias cause minimal symptoms, and people live with them for quite some time. But when they start causing you symptoms, meaning pain, swelling, the worst case scenario is a bowel obstruction, then those need to be fixed. And we try to fix those in a non-emergent manner rather than as you come to the emergency room in horrible pain or with that bowel obstruction, and then you need an emergency operation. So if you think you have a hernia, the best thing is to consult your doctor, find out, is it really a hernia, and then what options are available to fix that. We can have a long conversation about hernias. If you'd like more information, feel free to visit our website or also our YouTube channel where we post information about hernias. Sometimes I post some pictures or movies, and then if your doctor or you are pretty convinced you have a hernia, please feel free to call and make an appointment where we can assess your unique situation in person. Thanks for watching, and welcome to Surgical Associates.